So this presentation is for federally qualified health centers, rural health centers, and tribal clinics. And this has to do with the wraparound payment process. And it's being presented today, September 17th, 2015, by the Oregon Health Authority. Our agenda for today, we have some introductions, and then we'll talk about the wraparound payment. We will discuss the purpose of the payment and the process, any inclusions and exclusions when it comes to reporting for the wraparound payment, and also we'll go over the template and data reporting. We also have quite a few frequently asked questions that we've included at the end of the presentation. They include global billing, co-payments, third-party liability, qualified Medicare beneficiaries, and we'll talk a little bit about alternative payment methodology. Okay, so introductions to get started. Your OHA representatives that are here in the room, I have Linda Fanning. She's the policy analyst for FQHC, RHC, and tribal clinics. I also have Eric Larson. He's a fiscal analyst for the wraparound payments. Jamal, I don't know how to say your last name. Furkan. He's a policy analyst with the alternative payment methodology. He's the program manager of that. And I'm Jennifer Smith. I'm the Medicaid program trainer. We also have a couple of partners, providers that may speak up later in the presentation to give you a little bit of information about how they are reporting on their quarterly reports. We have Michelle Manso, Practice Management Auditing Specialist with Grand Ronde. And we also have Ellen Franklin. She's the Medical Billing Supervisor at Lincoln County Health and Human Services. All right, so let's talk about the wraparound payments. So regarding the wraparound payment, the federal government guarantees that clinics can be reimbursed up to the PPS encounter rate when serving managed and coordinated care members, that if you were to bill directly to OHP, that those claims would have paid at the PPS encounter rate. The wraparound payment purpose is to reimburse the cost of care for services provided to members that are enrolled in a plan, and those are for claims that are not paid at the encounter rate. So that's its purpose. And it is important to note that wraparound payments are not additional revenue. It's just to make up that cost of care for services for the members that are not being paid at that rate because they're in a plan. The wraparound payment process, the service is rendered, that's your encounter, and the clinic bills the CCO or managed care plan. And then that plan submits encounter data to the MMIS, which is the Medicaid Management Information System. And then the clinic submits encounters and payments to the Oregon Health Plan for the wraparound payment. So that's the basic process. And within that process, we have some responsibilities for providers and OHP staff. So the provider is responsible to bill for the services rendered, and then receive payment. Once you receive payment from all payers, then you submit quarterly reports to OHP to receive payment in aggregate up to the encounter rate for qualified services. And then once you submit that quarterly report, OHP staff reviews information that's submitted and compares that to the services submitted by the CCO or the plan. So they go into MMIS and compare that information, and then they calculate the wraparound payment. Say the key. All right, so just a little bit about the quarterly submission. We're going to show you the template and talk a little bit about what you should include and what you shouldn't include for the wraparound payment. So here is the cover page for the quarterly report. You should have an Excel file, right? Did they all have this? Okay. And this is tab 1 on the Excel file. And we generally call it the cover page. I do want to point out, I'm going to point to it over here, in these received amounts here, that you would be reporting under received capitation amounts, you would include risk withholds and capitation payments there. And those payments will be listed on the summary, which is the cover page, but they're not listed on the details, which is the second tab on the Excel file. So that's where those are listed under received capitation amounts. And then here's the detail. This is tab 2 on the Excel file, the quarterly report template. And then we'll talk about what you should include. So do include on the quarterly report cover page. So that's that first tab on the Excel file, costs incurred. So your expected number of encounters from the encounters worksheet and PPS encounter rate. You also need to report payments received. That includes capitation amounts, co-payments, CCO and managed care plan payments, Medicare payments if applicable, third-party liability, and interim payments from OHP. So you're reporting all of the payments that you've received for all services, and that does include labs and radiology. On tab 2, this is in the details, the quarterly report template. You want to include your encounter details, client information per encounter, so the client's first and last name and their client ID or prime number, whichever way you refer to that. Also, the dates, encounter information and details include dates of service, procedure code, modifier, diagnosis, and payments received for all services, including labs and radiology. So these are exclusions. These are things that you would not include on your quarterly report for wraparound payment. Again, the payment is designed to make up the difference between the payment received for OHP covered services in aggregate that are provided to managed or coordinated care members when OHP would have paid the clinic at the encounter rate. So if you would have billed us directly, if your client perhaps isn't enrolled in managed or coordinated care, if you would have billed OHP directly, if you would have received your encounter rate, this is just to make up that difference that you didn't get from the managed or coordinated care. So you don't want to include services for members with benefit plan QMB or MED, that is Medicare beneficiaries only, and also for CALM clients, the Citizen Alien Waived Emergency Medical. Also, don't include services provided under a separate provider ID. So if you have separate provider IDs for, say, DME or pharmacy or targeted case management, you want to not include those services on the wraparound payment summary. Also, just a note, I want to go back to that really quick. Each quarterly report. Oh yeah, I did say that. That each quarterly report should only report encounters or payments for one Medicaid provider. So one report is one provider ID. So I just want to stress that point. And then let's talk a little bit about frequently asked questions that have come in. First question, what if a third-party liability pays more than managed or coordinated care, but less than the PPS encounter rate equivalent? So again, the goal of the wraparound payment is to make up the difference between payment received or what you would have been paid had you billed OHP directly. Clinics should report any and all payments received from outside sources and all payments made and encounters and services provided. Wraparound payments are made in aggregate, not per claim. How should a clinic report copays on the wraparound data submission? So when a service does require a copay, the copay needs to be reported as a payment, whether or not that copay was received by the clinic. And that is stated in Oregon Administrative Rules. And also you can find OHP Plus copayment questions and answers on our website. How should a clinic report capitation payments, per member per month payments, and risk withholds? So that was on the tab 1, the cover page of your quarterly report. Under received capitation amounts, you would report your capitation payments, your per member per month, and risk withholds. How should a clinic report case rates? You would report these when they occur, and they're similar to capitation payments. Okay, next question, are services provided to MED or QMB members eligible for wraparound payment? So again, that QMB is a qualified Medicare beneficiary, and the answer is no. These members are not Medicaid or OHP eligible. The benefit plan is listed because we cover only Medicare copays and deductibles. We follow Medicare rules for those folks. Next question, what are the time frames for claim submission, wraparound data submission, and CCO data submission? So the claims need to be submitted by the clinic to the managed and coordinated care plans within 4 months of the date of service. And that is because the plans need to submit encounter data to MMIS within 180 days. Federal law requires that Medicaid agencies settle up at least every 4 months for the PPS encounter. So wraparound payments will be processed on a quarterly basis, and that includes a final reconciliation. That's an Oregon administrative rule that's listed there. And then some clinics may submit preliminary data and expected payments, which are settled at a later date when the actual payments are made by the plan. Next question, how should a clinic report global procedures on the wraparound report? So first of all, global procedures are not paid on a fee-for-service basis, but some plans may require a clinic to bill OB global codes, and you can see some examples there. What you would do is report each office visit and the delivery separately, and you would add the modifier OB to those services on your report, and then report the global payment when received. Next are encounter payments through managed or coordinated care reported to OHP through the MMIS. So yes, plans are required to submit their paid amounts on their encounter claims. And the only reason encounters would not be present in MMIS is if the claim was denied, or if the service was subcapitated or included in another service, or if another payer paid more than the plan's allowed amount. All right, so we're going to go ahead and open it up for questions now. I know we've had quite a few come in already. Maybe not quite a few. All right, and I do see some email addresses there. Perfect. I'll get the presentation out to you folks. Very good. All right, first question. Do we include when total payments are more than the PPS rate? Yes, you should include that. Next question. We have used modifier TH to identify the OB services. It sounds like the modifier for OB has now changed. Is that correct? So they would use OB, or is it modifier TH?
I've usually seen OB. I've not used TH.
Okay.
Is it I'm wondering if it's an actual modifier they're using, or we can follow up Shariba on that.
Okay, we'll look that one up. Okay, next question. Our rural health clinic is one of 4 clinics whose patients are paid per member per month, regardless of where they seek services. Do we have to report the capitation payment received for all patients, or can we carve out and report only those patients per member per month seen in the rural health clinic?
It's all. I've never carved it out, and I've never. We can do that.
I'm wondering if that's APM clinic.
Well, I heard them kind of referencing per member per month payments in regards to capitation from CCOs and other payers. So I guess you'd want to make that distinction between, is the per member per month payment part of the state alternative payment methodology, or is that a per member per month payment coming directly from the plan? I would think if that per member per month payment is coming from the CCO or managed care plan, you would need to report all of that revenue.
Next question, our clinic is set to open a Title X clinic. The question that came up during our roundtable today focuses on the Medicaid managed care patient that comes into the Title X family planning clinic. Are these encounters eligible for WRAP? So I think the general rule on that is that you don't want to be pulling funds from the different titles. So Medicaid being Title 19 and 21, if you're already being paid for a service through Title 10, then it would not be also payable through Title 19 or 21.
But if you would have been paid through the FQHC for that encounter, then you would bill it through the FQHC, and it would be eligible for your wraparound. The FQHCs should not have a separate family planning clinic.
So maybe that's an important point to touch on. I know that a lot of clinics might have several different billing IDs in the MOAS, but the goal is for all FQHCs, and that includes the organ administrative rule around this, that services provided to Medicaid beneficiaries will be billed using one distinct Medicaid ID number.
Right, and I think that's also why we wanted to stress earlier that your quarterly report for wraparound payment should be under only one provider ID. It shouldn't be under, if you have multiple provider IDs, for example, for DME or targeted case management, this wraparound payment is through the clinic's ID and just one ID per report. Next question, if each visit of a global OB is paid, is the delivery paid as an encounter? Yes.
There's a few RHCs that have delivery paid at a other than the encounter rate. But the majority of deliveries are paid at the encounter rate.
Okay, next question. Are patient access payments included on tab 1? So would that be another thing that they would include under received capitation amounts?
Kyla, this is Linda. You might want to email me because I'm not sure what a patient access payment is. But and then we can answer that question.
Based on the timelines noted, what claim service dates would you recommend we use if we're going to submit our first wraparound payment request? Based on the timelines noted. Okay, so it's a quarterly report, right?
Yeah. Typically it's a calendar quarter, so
right.
The first calendar quarter of services delivered would be the time frame submitted for the first report.
So January 1 through March 31.
Right, if they began delivering services January 1.
Well, right. And if you started on February 15th, then you would do February 15th through March 31 because that's the first quarter?
But we have RHCs to report on a monthly basis. So it would be the same point. It would be about 3 months back, 2 to 3 months back before they want to do that for those clinics that are paid on a monthly basis. At least 60 days back.
Okay. Family planning supplies are paid outside of the encounter rate. Should we not include the supplies in the report, or are those transactions removed before the WRAP payment is calculated?
Don't include family planning supplies in the WRAP report or payment for those, because those should be paid to you at your acquisition cost. So, so you can keep family planning supplies out of the WRAP report. That you can keep any payment out.
Next question. I understood that only payments related directly to encounters were the payments reported. Is that not correct? Because risk is paid based on encounters. However, access payments are patient-related, but not encounter-related.
So if there's a risk withhold from claims, so say, for example, you have a encounter rate of $200 and your risk withhold is 5%. So you would, you're able to receive up to that full amount for the services you provide. So if a plan provides you with that risk payment, that is a payment that you would have been eligible for, so that we should not pay for what they withheld when they pay it to you, if that makes sense. So you may get risk withholds in a lump sum, but those should be reported when they're paid.
Okay, next question. What are the types of encounters that qualify for wraparound payment? Is it limited to only visits with the primary care provider?
In general, the types of encounters that we would pay fee-for-service would be face-to-face visits with a core provider. Mental health claims and addictions claims will also be paid for non-core providers if the clinics have a certificate of approval from the Addictions and Mental Health Division to provide those outpatient services with unlicensed providers. So basically it is encounters for face-to-face visits with licensed providers.
Okay, there's a follow-up on that one. To qualifying encounter type, if adjudicated or capped by the CCO, would an immunization-only visit qualify for a WRAP payment?
Yes, that's correct. Immunization-only visits do qualify for a WRAP payment because we would pay them fee-for-service.
Next question. We have been told incentives payments are excluded. Is that correct?
That is correct, yes.
Next question. How far back can we go to claim the wraparound payment? Are there any timely filing limitations?
There are no timely filing limitations. If it's a significant amount of claims, it could be a budget concern for us. So if you have any specific questions, let us know. Otherwise, you're entitled to that WRAP payment.
All right, we don't have any more questions coming in right now, so I would like to go ahead and check in with Michelle and Ellen and see if either one of you have anything to add to the discussion about how the quarterly wraparound is working for your clinics.
This is Michelle. We've been doing pretty well for quite a while. I just wanted to put out there that any of those clients, especially those that are tribal that have NextGen, if they need help, I've had some contact me directly that are having difficulty creating the report. I can walk them through that. So my contact information is in the presentation. So if they need some help with that, they can go ahead and contact me.
Okay.
That's great, Michelle. One thing I wanted to add for the tribal clinics, and Michelle will know this, but so that tribal clinics, whether they're contracted with managed care organizations or not, are entitled to payment for their services they provide to their tribal members who are enrolled with managed care.
Correct.
And then those claims can be included on the wraparound report. So that's just a slight difference with the FQHCs and the RHCs.
Hi, this is Ellen, and I don't think I have anything to add at this time. I think you guys
Okay.
hit on a lot of the stuff that's affected me.
All right, thank you.
Brief talk about the alternative payment methodology for FQHCs, RHCs, and tribal organizations. So the Oregon Health Authority, in conjunction with the Oregon Primary Care Association, have created an alternative payment methodology that pays per member per month instead of RAP payments and fee-for-service PPS payments. And so at this time, we currently have 11 health centers, well, actually 10 FQHCs and 1 rural health center that are participating on the APM program. And so as that relates to wraparound payments, for the health centers that are participating on the program, there are certain services that are carved out of the per member per month payments. So right now, the per member per month payments are issued for primary care medical services. So the dental services, mental health and addiction services, some prenatal and OB services will continue to pay at the PPS rate or through the wraparound process. For APM clinics and health centers that are on the program, we would only anticipate that you submit those encounters to OHA for the wraparound payments. So after launching on the program, you're now receiving the per member per month payment instead of the wraparound. So we want to try to exclude from the actual wraparound process any areas where those encounters might be duplicated or duplicate payments may go out. And so we would request that for those clinics participating on the APM program to only submit dental services, encounters and payments, mental health and addiction services, and the agreed upon prenatal and OB services at this time. And I'll pass it back to Jennifer.
All right.
Next question, how can we access the recording of this session? So yeah, we are recording right now. The session will be available probably early next week on YouTube, and I will send out a follow-up email as soon as it's posted to everyone who registered. So even if someone wasn't able to make it but they registered for the session, they'll get that link.
So it looks like we got another question about the alternative payment methodology. So Linda Drebin stated, I'm curious as to whether those centers using the alternative payment methodology are seeing their reimbursements the same, less than, or more than when they did the regular wraparound process. So one of the tenets of the alternative payment methodology is that health centers and clinics are reimbursed at least the cost of care, similar to the wraparound process. So health centers and clinics will never be reimbursed less than what they would have received through traditional PPS payments. We do not recoup any amounts that are paid above the PPS equivalent. So we still kind of track their encounters to see what they would have been paid and establish that PPS equivalency. But one of the goals of the APM program is to incentivize health centers and clinics to engage with their population in a more patient-centered approach with their care teams through a lot of non-billable patient engagement strategies. So one of the anticipations of
health centers joining the program is that billable office visits will begin to decrease, and we'll see increases in alternative enabling type services. So in order to prevent or disincentivize that sort of advancement of the care model, we do not recoup any amounts that are paid above the PPS equivalency, because health centers, after making that transition onto the program, are now being paid for their general patient population rather than just those patients that walk through the door in a given time period. Great question.
Okay, next question. How can we get the spreadsheet for the RAP report? So, you want me to just send it out as an attachment?
Sure.
Okay. So in the follow-up email, I'll go ahead and send out that template to everyone. Next question. When an encounter cannot be reconciled, what does that mean?
Well, this is Eric. If it's not reconciled or matched, is the terminology I use in the initial payment that you received, we give you the opportunity to pull the EOB and send that to me as just a verification that it really did occur and was paid by the CCO. If in fact that can't be done, there's really not much more we can do unless it's a special circumstance. Generally, things that can't be pulled, they're either denied or the clinic could not find any evidence as well. So we just leave those out of the reimbursement process.
Updating, there is an OHA website for FQHCs, RHCs, and a separate one for the tribal clinics that we haven't kept very current. But what we'd like to do is provide links to this information and any other helpful information and start being more active in using that site for resources. So we'll make sure that everyone knows how to access that website once we get it all updated.
Okay, so we do have a couple other questions that came in. The first one is there an active list for the not paid PPS codes? And if so, where can we find the list?
So we do have somewhat of a list, but it can be kind of confusing because it kind of is our MMIS logic. So, and Eric has another list that he looks at, but we will make a commitment to provide information on that FQHC, RHC, and then the tribal clinic website that will outline those codes. But in the meantime, because there are literally thousands of codes, just keep in mind that the covered codes need to pair on the prioritized list above the line, above the funding line, and meet the definition of an encounter. And we don't, as you know, separately reimburse except for some tribal clinics, labs and radiology. But we will work to provide a more helpful document on that website.
Okay, next question. Are you aware of any clinics using Allscripts practice management system for billing? So in the room, I don't think we're aware of anyone. There may be some clinics on the line that use Allscripts practice management, and if they would want to partner with you, it says we need help with designing a report. So I'm not sure if any of the other clinics on the line use them, but there might be some resources amongst the providers. All right, looks like that's all the questions that have come in for today. So we're going to go ahead and let you go a little bit early. I just want to thank everyone for being here today and thank our panelists that had additional comments to add. We are going to take this one last question that just came in before we let you go. How do we report risk withhold info on the cover page? Where does this information pull from? So on the cover page, let me go back to that slide real quick. Hold on one second. All right, so here's that slide. And then in received capitation amount, this is where you would include your risk withhold and capitation payment. So right there where the arrow is. And that's again on tab 1 of the Excel file on the cover page. All right. And again, what if we do not get a capitation fee? Do we still include risk withhold? Yes, you would. Still include risk withhold. All right, I want to just thank everyone again for being here today. If you have additional questions, we did put up some resources there for you, OHA representatives, and a couple of partners out there that you could contact for additional information. And thank you so much for being here.